Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomba, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Mr. Noble Maungwa is with me on the sign language desk. On Monday this week, the country received a donation of 200,000 doses of Sinopharm COVID-19 vaccine from China. This donation generated a lot of public interest. My update today is therefore going to be on COVID-19 vaccines, once again, as we talked about last week, but with a focus on the Sinopharm vaccine. But first, our usual weekly COVID-19 statistics update. As of Thursday, the 18th of February 2021, Zimbabwe's cumulative number of COVID-19 cases was over 35,543, with over 31,821 recoveries and 1,420 deaths. Bulawayo and Harare metropolitan provinces once again remain the nation's main hotspots. It is, however, encouraging to see that the numbers in these metropolitan provinces are also going down. And that the country's epidemic curve continues to actually show a downward trend. This is a good indication that the national response is on the right path. The pandemic is being brought under control. Introduction of vaccines is going to actually further strengthen the national response and hence help speed up the national recovery. So coming on to the issue of Sinopharm vaccine that we received this week, many have asked if this vaccine has been registered for use. The Medicines Control Authority of Zimbabwe has indeed, in terms of Section 75 of the Medicines and Allied Substance Control Act, Chapter 15.03, granted authority to the Ministry of Health and Childcare to import and use the Sinopharm vaccine. This is based on the science-based emergency use authorization processes that the authority conducted. Globally, scientists have recognized that in an emergency, such as the COVID-19 pandemic that we're in now, it may not be possible to have all the data that regulatory bodies would normally need before approving a drug or vaccine for use. Country regulatory bodies worldwide, such as our own Medicines Control Authority of Zimbabwe, can therefore authorize the registration of new medicines or vaccines for emergency use. This authorization is given when there is evidence that strongly, and I mean strongly, suggests that the patients can benefit from the use of the new medicine or the new vaccine in this case. In other words, an emergency use authorization is a mechanism to facilitate the availability and use of medicines, including vaccines, during public health emergencies, once again, such as the one we're in now. So what is the difference between the Sinopharm vaccine and other vaccines on the market? Some have said, why just the Sinopharm vaccine? Well, COVID-19 vaccines that are currently in development and under WHO evaluation processes can mainly be distinguished based on the technology that they use or how they actually work. On one hand, there are vaccines such as the Pfizer that use work through new technologies such as the use of genetic material, the famous messenger RNA, to produce immunity in an individual and hence protect that individual. On the other hand, there are vaccines such as the Sinopharm vaccine that we've just received. They use traditional vaccine technologies. Specifically, they use whole inactivated virus, what we can also call killed virus, to produce immunity in an individual. This traditional vaccine technology is a very familiar, tried and tested technology that most traditional vaccines that we know, that we are using, that we have used in past actually use. So what are some of the Sinopharm vaccine characteristics that people have asked about? Well, first, the Sinopharm vaccine is basically an inactivated, I want to repeat, an inactivated or killed vaccine with no risk of causing the actual disease. The inactivated virus causes the body to develop an immunity or produce antibodies that protect the individual from getting the actual or the active COVID-19 disease. Sinopharm vaccine efficiency is reported to be 79% up to 86% in the UAE, where it has been used quite a bit. Number 4, the vaccination schedule for Sinopharm vaccine is 2 doses. One gets an initial dose, and then they wait 21 to 28 days for the second dose. Finally, point number 5, for characteristic number 5, the vaccine should be administered by a qualified, trained healthcare worker only. Prior to vaccination, all the non-potential side effects are to be clearly explained to the individual. A number of potential side effects of Sinopharm vaccine are very similar to what we have observed or seen with other traditional vaccines that we have used in the past that we're very familiar with. So following yesterday's vaccine program rollout launch, which took place at Wilkins Hospital, the Vice President, Dr. Sichi Wenga, who is also the Minister of Health and Childcare, was the very first person to get the Sinopharm vaccine. So following that process, a number of people have asked when they too or everybody else is going to be vaccinated. The vaccine program rollout is in 3 phases. The first phase, targeting frontline workers, and healthcare workers are the first to get this vaccine in this phase, in view of the fact that they're actually at the highest risk of contracting the disease. So phase 1 is actually divided into stage 1 and stage 2. Stage 1, we're targeting the healthcare workers first. Stage 2, the other frontline workers. The second phase will cover a high priority groups, such as those with the comorbidities that we've talked about a number of times, whether you have diabetes, high blood pressure, also the chronic illnesses, the same ones, and those who are actually 65 years and above. Whilst phase 3 finally will cover the rest of the population. You and I, if you are not a healthcare worker, if you are not a frontline worker, if you don't have all those other conditions, and if you are not greater than 65 years of age. And of course, more detail in these areas is available from your healthcare worker, your healthcare provider, your nearest clinic, your hospital, and so on. The COVID-19 free hotline numbers, the 2019 or the 2023 and the Youth Advocates number are also available for further information on this program. So as we roll out the National Vaccine Program, we're very excited about it, by the way. Let us once again remember that the vaccines are not the magic bullet. They're not 100%. They don't provide 100% protection for this disease. We still need to continue washing our hands with soap and running water, or sanitizing our hands with alcohol-based sanitizers, and to always wear a face mask and do it properly. Thank you.